A key program providing health insurance for thousands of Oklahoma children will soon run out of money unless Congress acts. Uncertainty over the federally funded children's health insurance program, coupled with legal challenges to a state revenue measure, could put a nearly $120 million hole in Oklahoma's health care budget.
20 years ago, millions of children across the United States lacked health insurance. That meant they couldn't get the regular doctor checkups and medications they needed to stay healthy. That began to change in 1997 when the Children's Health Insurance Program, or CHIP, was created. Becky Pasternak-Eichard is the CEO of the Oklahoma Health Care Authority, which is responsible for administering Medicaid and the CHIP program in Oklahoma.
It actually has reduced the uninsured rate for children in the state, and that is the impact really across the nation. And that was part of the goal of CHIP, was to really bring more uninsured children in under the coverage of the Medicaid program.
The CHIP program is aimed at children whose families make too much to qualify for Medicaid but can't afford private health insurance. Statistics provided by the Health Care Authority show enrollment in the state's Medicaid program, Sooner Care, which includes CHIP, totaled more than 540,000 children in June of 2017. That makes CHIP a key element in the effort to make sure children in Oklahoma have access to health care.
You know, medications they need either for acute or chronic conditions. It ensures access to inpatient hospitalization, outpatient services. So I think what it does is gives those families in Oklahoma peace of mind about their children's health care.
The Annie E. Casey Foundation, which measures children's well-being on an annual basis, says programs like Medicaid, CHIP, and the Affordable Care Act have significantly reduced the numbers of children from families without health insurance. According to the latest Kids Count report, the percentage of children in Oklahoma without health insurance has declined from 10% in 2010 to 7% in 2015. Oklahoma Institute for Child Advocacy Executive Director Joe Dorman says that could all change if Congress fails to act.
If we were to lose these federal dollars, you would see that number skyrocket, not only here in Oklahoma, but nationally. That CHIP program is there to help those families who are on the bubble, who are making just above the poverty line, but still can't afford that insurance for their kids. And it's the families who are working, the families who are trying to make a living, but their wages are just simply not enough to cover the cost of living and that additional insurance.
While lawmakers in the nation's capital have been debating health care, the future of Medicaid, and especially the CHIP program, remains up in the air. Funding for the CHIP program is set to expire at the end of September unless Congress reauthorizes it. Losing that funding would cost the state nearly $50 million in lost revenue.
We expect that we would exhaust our CHIP funding in the first quarter of 2018.
Further complicating the Health Care Authority's budget is the fact that while the agency did receive an increase in its appropriation for fiscal year 2018, it was about $35 million less than what they had asked for to keep pace with increasing costs and declining federal funds.
We were very fortunate as a state agency to receive additional appropriations than we did last year. We still are a little short, and so to accommodate that, one of the strategies that we have used in our budget is to push a single run into the next fiscal year.
What that means is that providers who would have received Medicaid reimbursement in June will instead be asked to wait until the next fiscal year begins in July. On top of all that, the agency's budget also includes $70 million in funding from a cigarette fee passed by the legislature earlier this year, a fee that now faces a legal challenge. Pasternak-Eichard says the agency would have to make further budget adjustments if that fee is ruled to be unconstitutional.
We are looking at a combination of a provider rate reduction, as well as if there are some changes we could make to some of our program benefits. What we are trying to look at is those kinds of benefits or programs that would least impact Oklahomans. But again, at this point, there are really no good choices.
At this point, the agency is trying to maintain a positive outlook on both CHIP and the cigarette fee.
We remain cautiously optimistic that not only the CHIP program will be reauthorized, or the funding for the CHIP program will be authorized, but if the constitutionality is not upheld, then that the special session would have a positive result for the three agencies involved.
A hearing on reauthorizing funding for CHIP is scheduled for September in the nation's capital. Meanwhile, the state Supreme Court will hear oral arguments on the constitutionality of the cigarette fee next week, with a decision expected before the end of the month.